Welcome back to The Explainer. Today, we're taking a spatial journey, literally tracing the incredible dynamic pathway of a single breath of air. We're going to follow it from the very moment it leaves the outside world, right down into the depths of the human body. Because anatomy, it isn't just about static textbook diagrams. It's about movement, function, and really elegant design. So let's dive right into this and see exactly how our bodies process the air we literally need to survive. So here's our roadmap for the descent. First, we're mapping the respiratory tract, then heading inside the nasal cavity, exploring the paranasal sinuses, checking out the anatomy of the larynx, and finally traveling down to the trachea. Let's get into it. Section 1. Mapping the respiratory tract. This is where it all begins. Let's take a look at the very entrance of the human airway. All right, so the journey starts right at the nostrils, the anterior nares. As you draw air in, it travels straight through the nasal cavity. Now, if you look closely, you'll notice the floor of this cavity is actually the roof of your mouth, your hard palate. From there, the air gets funneled backward toward the pharynx, sweeping past these intricate turbinates along the lateral walls. It's basically a highly structured hallway, perfectly designed to prep the air before it goes any deeper. Moving on to Section 2. Inside the nasal cavity. This is all about conditioning the air. Let's look at the complex bony and membranous structures that do the heavy lifting here. What's genuinely amazing here is just how efficient our biology is. The nasal cavity is lined with ciliated columnar epithelium, and these membranes have a massive job. They aren't just filtering out dust, they're essentially a rapid-fire atmospheric conditioning system. Get this, they can take chilly air, say around 6 degrees Celsius, and instantly warm it all the way up to 30 degrees Celsius before it even hits your deeper airways. That is a massive thermal jump in just a fraction of a second. Pretty incredible, right? So, how exactly does the nose pull off this incredible heating trick? Well, it takes a massive, constant blood supply. Check out this dense vascular network. Right towards the front of the nasal septum, we've got this highly concentrated bundle of blood vessels called Kieselbach's plexus, or you might know it as Little's area. This spot is where branches from both the internal and external carotid arteries actually converge. All that warm blood constantly flowing just beneath the surface, that's exactly what radiates heat into the air you breathe. But as you can imagine, having all those delicate little blood vessels sitting right at the surface definitely comes with a physical trade-off. And that brings us to a very real-world clinical consequence, epistaxis. That's just the medical term for your everyday nosebleed. Because Kieselbach's plexus is so exposed and so densely packed, it's super susceptible to trauma or just drying out. We classify epistaxis as primary or secondary. And depending on where it actually happens in that vascular network we just looked at, it can be anterior, which is by far the most common, or posterior. Just to give you a quick reality check on what epistaxis can actually look like, during a typical nosebleed, a person can lose about 250 grams of blood. That is roughly equivalent to an entire cup. I mean, it sounds like a lot, right? But it really just highlights exactly how rich and active the blood supply inside our nasal cavity truly is. All right, Section 3, exploring the paranasal sinuses. We're zooming out just a bit to look at the air-filled spaces inside the bones surrounding the nose. Working our way from top to bottom, notice the frontal sinuses right up there in the forehead area. Then you have the ethmoid sinuses resting right between the eyes, the deep-seated sphenoid sinus tucked further back in there, and finally, the large maxillary sinuses sitting squarely inside your cheekbones. All of these cavities are directly connected to those nasal passages we just traveled through. So what are these bony caverns actually doing? Well, they help out the nasal cavity by giving it extra surface area to warm and moisten that incoming air. But beyond that, they act like built-in acoustic echo chambers. They literally amplify your voice. Without them, we'd all sound incredibly flat and muffled. And here's a bit of fun trivia for you. The frontal sinus is actually completely absent at birth. It develops as we grow. Meanwhile, the maxillary sinus, the one in your cheeks, is the largest of the four. Next up, Section 4, anatomy of the larynx. As our breath leaves those upper cavities, it enters this highly specialized dynamic transition zone. Just to give you a sense of scale here, this incredibly complex musculoligamentous structure, the larynx, is only about 2 inches long. That's it. Just 2 inches of real estate in your throat handling some of the absolutely most critical functions of human life: breathing, protecting your airway, and of course, producing sound. So how is this 2-inch marvel actually supported? It's all built on a framework of cartilages. And to make it super easy to remember, we can break them down cleanly into threes. You've got 3 singular cartilages: the epiglottis, the thyroid cartilage, which is what forms your Adam's apple, and the cricoid cartilage right beneath it. Then you've got 3 paired cartilages tucked inside: the arytenoids, the corniculates, and the cuneiforms. Combine all those with muscles and ligaments, and you get this highly mobile, dynamic valve. Let's actually compare the outside to the inside. On the left side, looking at the external features, you'll see the broad, shield-like thyroid cartilage. It's there to provide some really robust physical protection for the airway. But then, if you look internally on the right, you see these delicate, highly specialized vestibular and vocal folds. This internal architecture is just beautifully designed. It snaps shut to prevent any food or liquid from accidentally going down the wrong pipe when we swallow, but it opens wide to let our breath easily pass through. Now let's contrast these 2 functional zones to pinpoint exactly where our voice comes from. The area called the supralarynx houses the vestibular folds. You'll often hear these called the false vocal cords because, well, they don't really produce sound, they're mainly there for protection. Right below that is the true larynx, which houses the vocal folds, your true vocal cords. When these vocal folds are drawn together or adducted, and our breath is forcefully pushed up between them from the lungs, they vibrate. And that highly controlled vibration, that is the foundation of literally every single word you speak. Finally, section 5, down to the trachea. The air has been warmed, filtered, and securely guided past the vocal cords. Now it's ready for the lower tract. To give you one last visual anchor for scale, the trachea, which most of us just call the windpipe, is roughly 4 inches, or about 10 centimeters long. It's the direct connection between the larynx above and the branching bronchi below. Check out this intricate web of primary and secondary tracheal arteries branching off here. They supply the muscular wall and the mucosal microvasculature. You can also spot the transverse intercartilaginous arteries wrapping horizontally right between those cartilaginous rings. It's this robust, continuous blood flow that ensures the tissues of this vital breathing tube stay completely healthy and responsive. Before we wrap things up today, I really want to share a fascinating clinical correlate located just behind this airway structure. There's this specific anatomical zone known as Killian's triangle. It's essentially a natural dehiscence, a weakened area in the muscular wall of the pharynx, sitting right between the inferior constrictor and the cricopharyngeus muscle. So why does this matter? Well, if there's excessive pressure in the pharynx while you're swallowing, the mucosa lining can actually bulge right out through this exact weak spot, creating a pouch known as a Zinker's diverticulum. It's just a perfect example of how our structural anatomy directly dictates clinical outcomes. Man, what a journey! We've tracked a single breath through the warming filters of the nose, past the echo chambers of the sinuses, navigated through those intricate cartilages of the vocal cords, and traveled right down the reinforced tube of the trachea. But you know what? This is really just the beginning of the story. As this perfectly conditioned air completes its descent, it stands right at the doorway of the lower respiratory system. So how exactly do the branching airways and the deep microscopic alveoli of the lungs take over to exchange gases and literally sustain our lives? Well, that is a phenomenal process, and it's exactly what we're going to dive into in our next explainer. Until then, stay curious and keep learning.